Good evening. I'm Nima Rajan, and this is Forum Daily for Monday, August 22nd. And tonight, we begin with a meeting between the Prime Minister and the German Chancellor. Justin Trudeau and Olaf Scholz spoke at a joint news conference in Montreal today. The two accused Russia of trying to use the issue of turbine repairs as a cover for recent gas export cuts in a key pipeline. Mr. Trudeau defended his government's decision to allow the return of the first of 6 turbines being repaired in Montreal to Russian state-owned energy giant Gazprom. Now, Ukraine wants Canada to reverse its decision to exempt Siemens Canada from sanctions against Russia. The Nord Stream 1 pipeline supplies natural gas to Germany. Meanwhile, the Maritime premiers met with Ontario Premier Doug Ford today in Moncton. The premiers say they need a Team Canada approach to fixing the country's healthcare problems. They told reporters that the country's leaders need to create a plan to reduce the emergency wait times and surgery backlogs, but they wouldn't say when or how that would happen. Turning to a new campaign by the Canadian American Business Council called Travel Like It's 2019. It's putting pressure on the Trudeau government to scrap the ArriveCan app, clear up the Nexus application backlog, and take other measures to ease travel delays at the border. Council CEO Mary Scott Greenwood says Canadians have sent MPs nearly 1,500 emails through travellikeits2019.ca since the campaign began earlier this month. In Quebec, the health department is making a move that goes against a coroner's recommendation. It will be allowing long-term care homes to put up to 4 residents in the same room. A spokesman for the seniors minister says the move would help reduce an almost 4,300-person waitlist and ease pressure on hospitals. Coroner Jean Kamel investigated deaths in long-term care homes during the first wave of the pandemic, and she says Quebec should ensure that residential care facilities are able to offer single rooms to patients. This in order to prevent the transmission of COVID-19 and other diseases. On the West Coast, the BC Wildfire Service says fires may continue longer than usual this year. Information Officer Andrea Heath says wildfire season usually winds down the first week of September, but she says the Fire Service's weather modeling is saying the wildfire season will continue until at least mid-September. Officials are attributing the wildfire season extension to persisting hot and dry weather. And it's a similar story on the other side of the country. This year has been one of the worst for destructive forest fires in Newfoundland and Labrador. This with 24,000 hectares of forest going up in flames. Firefighters are no longer battling open flame in the central part of the province, but almost 60 firefighters are digging up hot spots to prevent continued burning. Meanwhile, thunderstorms that moved through the Greater Toronto area yesterday brought some heavy rains and caused flooding in some streets and homes. Environment Canada issued several weather advisories for the region yesterday afternoon. This includes a severe thunderstorm warning in Peel and a special weather statement for Toronto and York region. Many areas of Brampton and southern Caledon had about 100 millimeters of rain after a, quote, nearly stationary storm there. A union representing education workers says it will be holding a strike vote at the end of September. The Canadian Union of Public Employees represents 55,000 workers, such as maintenance staff, librarians, and early childhood educators. QP is asking for raises of 11.7% per year, while the government is offering 2% a year for the lowest paid workers and 1.25% for everyone else. Moving to ongoing efforts to protect the endangered woodland caribou in Quebec. The federal and Quebec governments say they are confident they can reach a deal. Federal Environment Minister Stephen Guilbeault warned Quebec in April that Ottawa would act unilaterally to protect the animals. This comes after the province failed to present what he considered an acceptable conservation plan. The two governments now say that Quebec is working to ensure that 65% of the caribou's habitat is undisturbed, and that the province plans to release its full protection strategy by the end of next June. A new monument to commemorate the signing of Treaty 6 now stands on the Alberta Legislature grounds. The design includes a tribute to medals given by the British Crown at the time of the signing of the treaty 145 years ago. which features a settler and an Indigenous leader shaking hands. The sculpture is a collaboration between the Confederacy of Treaty Six Nations, the province, and the city of Edmonton, and it was unveiled on Sunday morning. Alexis Nakota Sioux Nation chief Tony Alexis says it's an important reminder that the treaty continues to be recognized in Alberta. All right, stay with us. We'll be back after the break with a look at how inflation is impacting seniors across Canada. We'll speak with Diana Cable from CanAge about how older Canadians are being impacted on many levels by these rising costs. Stay tuned. Experts are saying that sky-high inflation is putting Canadian seniors at increased risk of social isolation. Many older adults live on fixed pensions or government benefits that aren't keeping pace with the rate of inflation in 2022. Now, this means that many are being forced to cut back on gasoline, transit fares, and entertainment costs, like eating out or taking classes. Seniors who can't afford internet or a cell phone are also less able to stay in touch with family and friends. Loneliness and social isolation in older adults has been linked to depression, an increased number of falls and use of health services, and even premature death. Well, with us now to discuss the issue is Ms. Diana Cable, the Director of Policy and Research at CanAge, Canada's national seniors advocacy organization. Ma'am, welcome to Forum Daily.
Thank you very much for having me.
So we mentioned government benefits or fixed pensions aren't really keeping pace with inflation. But what about the investment portfolios of seniors, including real estate equity, which I'm sure a lot of seniors were relying on? How is inflation impacting these long-term investments and financial security of seniors?
So for those who depend on who are using their homes as equity and are planning on using that into their retirement, either through a reverse mortgage or some other kind of funding, they're now taking a reduced cut, meaning there isn't enough money in order for them to do all the things that they had planned to do in their retirement.
And amid all of this, what have you been hearing from seniors in terms of their quality of life following the impacts of inflation?
Well, you mentioned one of the big ones, and that's depression. It's easy to fall into depression if you're always concerned about whether you have enough money to be able to buy nutritious food or to pay for your rent or your medications. These aren't things that we should have to be worrying about.
And all of this cutting back, as we mentioned, is contributing to social isolation and the connectedness with family and friends. So, in what ways does this in particular affect the overall mental and physical health of seniors in Canada?
Well, there was a study a few years ago that came out that said that social isolation can impact your health, mental and physical health, as much as smoking 15 cigarettes a day or an overuse of alcohol. Think about that. That's very dramatic. So, if you're not leaving your building, if you're not even going out to buy groceries as often because you don't have enough money, if you're not going out to visit your friends, if you can't pay for your internet, as you mentioned, so you can't afford to do FaceTime with your children or your grandchildren or friends, even gaming online has become popular. Words with friends, for example, Scrabble with friends. When these things get cut out, you are isolated and sitting in your apartment or your home by yourself.
Some very surprising information there, Ms. Cable. So, just how many seniors in Canada are being impacted by this right now?
Well, we don't know 100%, but what we do know is that almost 28% of seniors live on their own in Canada. That's a quarter of our population, or over a quarter of the senior population. So at a minimum, it's affecting, I would hazard a guess, a quarter of the seniors population.
All right, ma'am, let's talk about solutions. What kind of steps can our officials take to better address the needs of seniors amid record inflation?
Well, that's a tough question because they are balancing what they can do for the entire country and helping us get through these tough times of high inflation. But I think that, and there are so many factors involved, but I think that one of the things that the government can do is that they can be listening actively to their constituents to ensure that people's core needs are being met, especially food security, housing, and healthcare, particularly when a time like this, when many older Canadians and frankly other Canadians are really, really feeling the pinch. So they need to be able to listen and respond so that people aren't making difficult choices such as choosing food or medication.
And bringing this back to our viewers at home, what are some ways that individual viewers can get involved, especially with their senior loved ones?
So, with your senior loved ones, make sure you're reaching out more regularly than you may have been doing in the past. Even a short phone call once or twice a week goes a really long way. It doesn't even have to be a check in phone call. It can, just be, hey, what are you having for dinner tonight? I'm thinking about making this. Remember that recipe you made one time? It can be really casual. Also, if you have older Canadians living in your neighborhood, reach out to them, knock on their door, invite them out for coffee. Front porch coffees are a great thing, and we still have warm enough weather that we can do that. Another thing that can happen within the community is there are lots of free programs. For example, somebody wrote into us and said that they had joined a walking club that their local library was coordinating, and that's a free activity, and it got them out and they were loving it.
Stay with us. More news from around the world coming up after a short break. This is day one on the job for one of the youngest and first Indigenous president of the Canadian Medical Association. Dr. Alika Lafontaine says Canada's healthcare system is in crisis and that he wants to advocate for a national standard for medicine that will be consistent across all regions. Dr. Lafontaine also wants to advocate for marginalized voices in healthcare and plans to draw on his Indigenous identity while working on solutions to a range of problems. Well, this comes as Canada's healthcare system continues to deal with staffing shortages, long wait times, and growing mental health concerns among medical professionals. Well, joining us now to tell us how he plans to tackle a system in crisis is Dr. Alika Lafontaine himself. Sir, welcome to Forum Daily.
Thanks for having me.
Now, I know adding a voice to marginalized communities is a priority of yours. So, as the first Indigenous president of the CMA, how do you plan to draw on your heritage as well as your lived experience as a physician in Alberta to help address the barriers that Indigenous communities and other marginalized communities continue to face in healthcare?
Anytime that you have a new voice around a table that hasn't been there before, there's an opportunity to really learn from their lived experience. We're in the midst of crisis in the mainstream healthcare system, but there's a long history of dealing with crisis in Indigenous communities across the country. And so we can bring in those learnings. We can take the principles that we know work from those decades of experience, focusing on the people who actually are affected, making sure that the people actually provide the care, provided the support, and making sure that we track where our resources go so we can make sure that the things that we think we're solving, we're actually solving in the course of trying to change healthcare.
And we know you're advocating for a national standard for medicine in Canada. So, what would that standard look like across the country?
So I think the word standard encompasses a lot of different approaches. So each of the provinces has their own approach to registration for health professionals. Each province has their own approach to the different rules that govern practice. They all have their different approaches to health and human resource management and the way that they define primary care within each province. And so, depending on whether you live in Quebec or whether you live in British Columbia, those can look very, very different across the country. I think what we've learned in this pandemic is that there are certain things that make sense when you decentralize, and there's other things that make a whole lot of sense to centralize. And going through the discussion of finding out which things we can adopt across the country so we truly do become a Canadian healthcare system instead of siloed territorial and provincial health systems is something that's well worth discussing, and that could lead to a lot of solutions to the problems that we face.
And turning to some of the key issues facing healthcare right now, staffing shortages are continuing to affect Canada's healthcare system. So, what steps are you pushing for officials to take to help grow Canada's medical teams, bring in more doctors, and keep the ones that are already there?
So there are immediate things that could be done. The first focus of any government should really be ensuring retention of the people who work right now. And that can come in the form of different incentives. Some of those are related to money, other things are related to working conditions. But the second big part is making sure to have space to actually provide that high quality care that we all wanted to provide when we first came into medicine. One of the most satisfying parts of being an anesthesiologist, which is my own specialty, is connecting with patients and having them have a good experience from the very beginning of when they meet me to the end. And right now in the healthcare system, there's not a lot of space for that because we're so focused on doing things at the lowest cost at the highest volume. The third part is finally actually getting to that team-based care that we talk about. Every time that we talk about team-based care, it seems in recent news, We talk about replacement of one type of provider for another. For example, there's not enough family physicians, so who can replace family physicians? When in reality, if we drop the barriers of people mobilizing across the country to different parts, if we drop the barriers and create national approaches to things like virtual care, we can all lift where we stand and provide an environment for patients to get the best care where we all do what we do well.
All right, doctor, just about a minute left here. But after speaking to a lot of physicians and medical professionals on the show, we find that mental health is a huge concern within that environment. So how should officials address the issue of mental health among medical professionals as well?
Well, we definitely know that mental health has gotten worse for providers across the country in the past few years. Many people are deciding to leave practice or scale back the amount of time that they spend in healthcare. If there is one thing that we can get across is that mental health issues are a result of poor working environments. The stresses that you experience, you never recover when you go home and then come back to work again. We have a lot of health professionals who can't actually remember, an easy day at work. Every time you come in, you catastrophize another horrible thing that can happen. And I imagine for patients, having providers constantly on edge, worried about what might happen to their patients, doesn't lead to a good patient experience. So really doubling down on creating that space to provide an excellent patient experience and providing good working environments. I think that's the best way to address mental health in the health system right now.
All right, lots to keep our eyes out for at the CMA. Doctor, again, thank you for joining us today on Forum Daily.
Thanks for having me.
Stay with us. When we come back after the break, we look at the major headlines and news stories from around the world as Russia blames Ukraine for a deadly car bombing. That story and more up next. Russia's intelligence agency claims Ukraine's special services is behind the car bombing over the weekend that killed the daughter of a leading nationalist figure. The FSB has come out with very detailed information to back up its claim. It says a Ukrainian woman who arrived in Russia on July 23rd with her daughter rented an apartment in the house where Daria Dugina lived and spied on her from their car. The FSB says the woman attended the same festival as Miss Dugina on Saturday, and she then quickly departed for Estonia following the bombing. Tensions rise in Pakistan, where police have filed terrorism charges against former Prime Minister Imran Khan over a speech he gave in Islamabad on Saturday. Mr. Khan vowed to sue police officers and a female judge and claimed that a close aide had been tortured after his arrest. The opposition party he leads has warned that it will take over Islamabad if Mr. Khan is arrested and is trying to squash the charges in court. Meanwhile, Kenya's losing presidential candidate, Raila Odinga, has filed a Supreme Court challenge to last week's election results. He is asking the court for a new vote. Now, this starts the 14-day period in which the court must rule. Deputy President William Ruto was declared the winner of the close August 9th election. The peaceful election turned chaotic in the final minutes before the declaration. This was when the Electoral Commission split, and a majority of commissioners said they couldn't support the result. Well, amid the growing North Korean nuclear threat, the U.S. and South Korea are holding their biggest combined military training in years. The Ulchi Freedom Shield exercises will continue through September 1st in South Korea, and they include field exercises involving aircraft, warships, tanks, and potentially tens of thousands of troops. Washington and Seoul describe their exercises as defensive, but North Korea portrays them as invasion rehearsals that justify its nuclear weapons and missile development. North Korea has pushed its weapons testing activity to a record pace this year. Well, as officials in the U.S. prepare for a fall vaccination campaign, one pharma giant is pushing for its booster vaccine to be approved. Pfizer has asked regulators to authorize its combination COVID-19 vaccine that adds protection against the newest Omicron variants. The move is a key step toward opening a fall booster campaign in the U.S. If the FDA quickly clears the combo shots made by Pfizer and its partner BioNTech, boosters could be offered within weeks. Moderna is expected to file a similar application soon. All right, well, meanwhile, America's top infectious disease expert is stepping down. Dr. Anthony Fauci says he will leave his 3 government jobs in December after more than 5 decades of service. Dr. Fauci serves as U.S. President Joe Biden's chief medical advisor, is the director of the U.S. National Institute of Allergy and Infectious Diseases, and chief of a laboratory of immunoregulation. Authorities in Jerusalem, New York, and London say polio is spreading in those cities, and the origin is the oral vaccine used to wipe out the disease. In what is an extremely rare phenomenon, recently discovered polio viruses in the cities are mutated versions of the weakened form of the live virus used in the vaccine. The latest incidents represent the first time in several years that the vaccine-connected polio virus has turned up in rich countries. Researchers are sounding the alarm on the depleting glaciers in Switzerland. They have found that Switzerland's 1,400 glaciers have lost half their total volume since the early 1930s. And their first ever reconstruction of ice loss reveals that ice retreat is accelerating. This comes at a time of growing concerns about climate change. The researchers found that two periods, in the 1920s and the 1980s, actually experienced sporadic growth in glacier mass. But they say that was overshadowed by the broader trend of decline. A Winnipeg-born actor and playwright is part of a team spearheading an online art auction that is raising funds for war relief efforts in Ukraine. Michael Rubenfeld has been living in Poland for the past 5 years. He says the idea came together when the arts collective he works with in Krakow had to pivot its operations to help with the ongoing war. The Fight with Art auction features more than 130 pieces from roughly 40 Ukrainian artists. Parts of the proceeds from the auction, which ends September 4th, will go to the artists, while the rest will go to 4 charities. All right, I'm Nima Rajan, and that'll do it for your look at national and international news for today. Remember, for more news on demand, you could always visit our website, thenewsforum.ca, and make sure to follow our social media handles on Facebook, TikTok, Instagram, and Twitter. You can also watch all of our commentary, programming, and interviews on the News Forum YouTube channel. Thanks for joining us today on Forum Daily News, and we'll see you again next time. Take care, Canada.